Utah instituted a new policy of welfare drug testing recently, and we now have data on exactly how the first year of it went. So in the period between August 2012 and July 2013, they did a number of tests actually, and we're talking specifically here about applicants to the Temporary Assistance for Needy Families program, one of the welfare programs available in Utah. Now, during that period that we referenced there, they had 4,730 applicants. Now, based on the initial written responses these applicants gave, they responded to about 10% and said, we want to follow up and do blood tests. And out of those, they had 12 confirmed drug users. Now, this is a program that cost them about $31,000 to institute over that period. And you've seen there that they've caught 12 people. Now, of course, some people who they followed up with did not go because they knew they had done drugs. That's certainly true. And they believe that they've saved the state of Utah about $370,000 by not having those 247 people who would have been collecting benefits will not now be collecting benefits. What do you guys think about this?
I don't have a major problem with this, actually. The testing itself, I mean, if people are going to be getting government subsidies for whatever the reason, then having to be drug tested doesn't strike me as something that's that intrusive. I'm not a huge government program guy in the first place, but if you're getting money from the government, it seems to me that they're allowed to know whether you're doing drugs or not.
I think my issue with it from the get-go is it automatically reinforces a stereotype about people who need government assistance. It's like, oh, you guys are all deadbeats, you're probably doing drugs, you're lazy, you don't want to work, we're going to drug test you. So I don't like pushing that stereotype, and as the numbers indicate, not that many people are actually using drugs when they're on welfare. The vast majority of people who are on welfare or need government assistance are working two jobs or doing their best to make ends meet, but they have children that they have to provide care for, and as a result the money that they're making doesn't stretch far enough. Yeah. So I don't like painting this picture of of welfare recipients as like these druggies. It really annoys me.
That's my main problem with it as well, and we've seen other states have instituted measures like this, or even harsher ones. Florida had mandatory drug testing. It wasn't some percentage, and they found after testing everyone over a period of time, 2.6% tested positive for some sort of drug. And I have the same problem with it that you do. I don't understand why, one, we're demonizing these people in their time of need, and specifically, why are we demonizing this one way that they're wasting their money or whatever? You could watch as much reality TV as you want. We don't test for that. You can drink constantly. You can eat totally unhealthy food. There's all of these different vices you can engage in, but if you smoke marijuana, they're going to cut you off. Now, in Utah specifically, you can still get the benefits, but they require that you take some sort of drug rehab program or something like that. But why are we demonizing this one particular negative activity?
And what if you're abusing pharmaceutical drugs?
Exactly.
I mean, it's just, how do you draw that line?
What if you're abusing alcohol?
Exactly.
Look, you can, in New York City, you can be on food stamps and you can literally buy all alcohol if you want. I mean, you can go to Duane Reade, which is the main drugstore in New York City, and it says very clearly, EBT taken here, and you could just stock up on beer, and that's it. So I'm not defending that, obviously, but that's why I think there's some level of this that I'm sort of okay with. But I get the idea about the stigma thing, though.
I would completely disagree with you. I have a big problem with this on a civil liberties basis. I think that it is unreasonable search. I don't think that there is a compelling state interest in making sure that this particular very small, very narrowly targeted group of people should be set aside for special testing and special searches. That's my problem, and I think that the actual issue here is that it is not anything. It's not about the money that's going towards supporting their drug habit. This is about punishing the poor.
Yes.
This is about finding additional ways to make it that much harder for people to access the services that they are entitled to. That we have, as a nation, have decided they are entitled to have access to this assistance, because there are not just the people who are testing positive for drugs. These people have children. These people have families. These people have other folks who are depending on them to be able to access these services. So when you have kids involved as well. So I have a complete and total, absolutely, I think these are stupid. I think the idea is just to punish people.